I'm a big outdoorsman, so I hunt and fish, I play golf, I play hockey, love to cut wood. I'm just active doing all sorts of stuff outdoors. I've had knee issues probably for the past 10 years or so. I was a pitcher, so a lot of wear and tear. You're putting a lot of force on both knees, whether you're driving off or landing and planting. So I do think that had something to do with it. Pain, walking up and down inclines and stairs, you constantly thought about it because you were stiff, grinding, and it was just, somewhat of an annoyance for work. I'm out in the field seeing people and clients. Certainly, it was bothersome.
Kirt's in his young 50s. He used to play professional baseball, and that toll of athletics all his life added up over the years, where he had loss of cartilage on the inside portion of his bone, where anti-inflammatory medicines and injections were not controlling his pain long term. We had kind of conversations about partial and total knee replacement. Majority of his wear is on the inside portion of his knee. However, he also had, under his kneecap, the second compartment had significant arthritis as well, and the option was to move forward with total knee replacement done through Mako robotic system.
He's like, this is the newest technology and it's going to be your knee for the next 30 years. So felt like, you know what, I want to get this done. I want to move forward. There's no reason for me to wait. Before you know it, you're out of surgery and done, and in the recovery room, and then it's the process of, hey, give it a little bit of time. We walked that evening. Actually, I spent the night in the hospital, went home the next day, and been recovering since. I just felt comfortable from minute one being here with his staff that every single person on the staff was consistent, and I thought that was one of the biggest things for me. Everybody knew exactly what I was going to go through, where I should be at certain points in time to take these precautions, wearing a mask, temperature-wise, who you're around beforehand. They were very strict about how they were approaching it, and I felt very safe. I just got the second one done now. The first one was done in January, and I'm happy. I'm very happy with where I'm at. And I've just felt good about it, and don't ever feel like I'm in a compromised position where this knee is gonna fail or not work like my original knee. It's better than that now because I'm able to do it without pain, so I feel much more comfortable with where I'm at with this one, and I feel like this second knee will be in the same spot here within a month or so. I'd have done it sooner if I'd have known how much better I feel. I would tell anybody, I just don't know somebody who's living in pain who shouldn't get it done. And that's everybody's individual decision. It would be Dr. Johnson recommending what to do, when to do it, but I think people sitting at home in pain, I'd reach out. Ms. Pedigree, along with the staff from here at the Bone and Joint Center in Holland, was two of the best experiences I've had, and I've had probably 11 or 12 surgeries.